This is the Louisiana Delta Paramedic Program. This skill is going to demonstrate a live birth, and we have everything set up to stimulate a childbirth. We have our BSI scene safe and appropriate equipment. We've been called to deal with an imminent birth. I'm going to approach the patient, introduce myself. I'm going to ask her how far along she is in gestation. I'm going to ask her if her water's broke. That's going to kind of give me an idea. I'm going to ask her if she's having contractions, and if she is, how far apart her contractions are. If she has told me her water's broke, we're going to check for crowning. I see that the head is crowned. We're second stage of labor. I would have instructed my partner to attach the mother up to our EKG monitor and assess vital signs. We're going to need to go ahead and start an IV at this time. Since the head is crowned, that's going to be my most immediate concern. I'm going to kind of do my best to keep the patient's dignity covered. I see that we have crowning. I'm going to instruct my patient whenever she does feel a contraction to push. And I'm going to support the head and face down as it comes out. I'm going to support the head and try to turn it upward, facing up. With each contraction, I'm going to continue to support more of the body that's exposed to me. Each contraction, we're pushing. That baby is delivered. I would then wrap the baby up in a sterile dressing, sterile blanket, and make sure our airway is secured. Suction with a bulb syringe, nose and mouth. And if my baby is lethargic, I'm going to tap its feet, kind of flick its feet, try to get a reaction. In your OB kit, you have these convenient little clamps. Clamp our cord in 2 places. Clamp it through the umbilical cord in a secondary spot. And we have a disposable scalpel to cut the cord. We've done that. We're going to assess the patient's APGAR score. I'm going to assess heart rate at the brachial artery. I'm going to assess respirations. I'm looking for muscle tone and how it reacts to me tapping its feet. If he cries vigorously or responds appropriately, that's a positive APGAR score. We'll give that a 2. Anything over 100 or better is a 2. The pink and warm would be a 2 also. We're looking for signs of cyanosis, in which case we may need to administer supplemental oxygen. This is a normal delivery, and my baby appears to have an APGAR score of 10. So now that we have 2 patients, we're going to continue to monitor the mother. We're going to expect placental delivery. Depending on our transport time to the hospital, we may deal with that. We're going to administer two IV lines, one of lactated ringers, one of normal saline. Continue fluid administration, and continuing to monitor vital signs en route to the hospital. Keep monitoring my baby for any changes, and make sure that we're going to reassess a APGAR score after 5 minutes and deliver to the hospital.